Capstone Project Visual Presentation: The Role of the Nurse Leader in Improving RN Engagement by Christina L. Cooke, Liberty University, Nursing 626. As RN engagement has significantly increased in importance over time, there is an increase in the importance of the nursing leader role in cultivating a culture of change. It is specifically important for a nurse leader to ensure that team members are provided with the tools and resources necessary to do their jobs effectively while promoting a workplace environment that supports the physical and emotional well-being of team members. Therefore, it is evident that a transformational leadership style which supports empowerment, exemplary professional performance, innovative ideas for improvement strategies, and authenticity is critical to the success of a team and the presence of RN engagement. Furthermore, nurse leaders must be easily accessible, approachable, and visible to ensure open communication, trust, and adequate RN engagement and participation in quality improvement efforts. As there is an increase in the prevalence of staff turnover rates among RNs in various organizations and corresponding individual units, there is a significant need for a nursing leader to ensure RN engagement and increase participation in unit-based shared governance activities. High turnover rates lead to decreased productivity, organizational inefficiencies, increased medication errors, and adverse patient events, and decreased quality of care. Therefore, it is critical for nursing leaders to focus on creating a work environment that is positive and fulfilling, leading to the retention of sturdy team members equipped with attributes of high vigor, strong dedication to work, and positive absorption or interest in work. By encouraging open communication and empowerment that inspires team member participation and expression of innovative ideas for change, a nurse leader can instill resilience, dedication, and persistence among team members to increase satisfaction, retention, and the delivery of optimal patient care. During this writer's practicum experience, nursing leadership identified a significant need for an increase in RN engagement and participation in shared governance within a trauma surgical unit. The goal for the implementation of this capstone project is to assist nursing leadership with enhancing RN engagement and participation in unit-based activities while increasing team member satisfaction, retention, and positive patient outcomes. Within a large urban academic medical center, it is key for a nurse leader to appropriately examine which drivers of RN engagement are most beneficial to incorporate among hospital units and associated team members for success. This writer has actively engaged and collaborated with various team members within a busy trauma surgical unit within the identified medical center to examine the relationship between team members' perceptions of drivers of engagement and their actual workplace engagement. This writer has also examined the key role that nurse leaders play in heightening the presence of such engagement, identifying that leadership styles and strategies of nurse leaders have a strong influence on team commitment and satisfaction. Identifying that perceived independence and recognition or appreciation are key factors in influencing RN engagement, as well as a high degree of nurse leader responsiveness to staff input, it has been identified that nurse leaders must strive to encourage teamwork, professional growth and development, recognition, and autonomy among team members committed to organizational success. By striving to aid in transforming the culture within a busy trauma surgical unit towards a workplace environment that fosters team member satisfaction and healthy working conditions, this writer plans to implement a strategy to promote an increase in RN engagement. By implementing this proposed project within a trauma surgical unit, this writer hopes to inspire nursing leadership to value the significance of adequate RN engagement and the success of enhanced recruitment and retention strategies, leading to heightened patient care outcomes and overall organizational success. By encouraging a transformational leadership style through the implementation of unit-based activities, this writer highlights the significance between a nurse leader's leadership style and their ability to enforce the presence of empowerment and engagement among team members. This writer stresses the importance of developing a leadership style that supports positive organizational behaviors, acceptance and preparation for change, and an increased congruence between personal and organizational values among team members. As frontline nurse leaders often work directly with team members, it is key to successfully and competently promote innovation, empowerment, participation, and commitment to patient care, safety, and organizational success. Furthermore, nurse leaders must be eager to undergo continuous leadership development that enables them to better maintain effective nurse-manager relationships, promote enhanced RN engagement, and create a culture of innovation. This writer hopes to emphasize the need for nurse leaders to encourage and support the open exchange of ideas and opinions, encourage participation of team members in decisions that affect their work, encourage teamwork, and appropriately respond to the presentation of concerns or issues. As evidence shows that nurses with high levels of workplace engagement have increased amounts of perceived effectiveness, there is additionally less burnout, higher levels of RN satisfaction, and a significant increase in the positive outcomes of patient care. The press-gaining national database of nursing quality indicators suggests the importance of nurse leaders identifying how performance changes in structural and process indicators affect patient safety, experience, and clinical outcomes. As nurse leaders are responsible for ensuring team commitment to organizational values and goals, it is evident that RN engagement is considered a powerful enhancer. Through promoting safe staffing ratios, effective communication, and team member empowerment that enhances RN satisfaction as well as patient outcomes, a nurse leader can encourage autonomy, demonstration of best nursing practices, and healthy interprofessional relationships through nurse engagement and decision-making processes. With an increase in RN engagement leading to increased RN satisfaction, retention rates are seen to increase, leading to a significant improvement in the quality of care delivered and associated HCAHPS scores. As nurse leaders play a key role in employee engagement, it is critical for a nurse leader to influence a workplace environment that supports positivity and optimism through setting clear goals, providing meaningful feedback, and encouraging empowerment and continual growth. Literature shows that it is key to support team members and to make them feel important as vital contributors of success, as satisfied and engaged employees are seen to be more involved, enthusiastic, and committed to their work than disengaged employees. Nurse leaders must grasp a concrete understanding of the connection between RN engagement and the presence of quality, safe, optimal patient care to successfully cultivate a workplace environment that supports a team who enjoys what they do and who is committed to excellence. As the NDNQI highlights several core measurements of clinical indicators such as nurse engagement, nurse job satisfaction, and the formation of a healthy workplace environment, a nurse leader must strive to incorporate innovative strategies aimed at decreasing burnout and employee turnover and increasing the presence of teamwork leading to organizational success. A nursing leader is responsible for organizing and influencing nursing practice that is consistent with ensuring optimal patient care through accountability and decision-making. An effective nurse leader promotes creativity and innovation to improve nursing quality, effectiveness, and efficiency while cultivating a workplace climate that maintains respect, trust, and dignity. As competent nursing leaders play a key role in influencing RN engagement, satisfaction, retention, and professional growth that leads to optimum patient outcomes, it is critical that a nursing leader encourages engagement through consensus building and conflict management, giving and receiving feedback, and clearly communicating a shared vision for organizational success. As previously stated, studies show that employees who are engaged in their work and committed to their organizations yield significant competitive advantages, increased productivity and efficiency, and lower employee turnover rates. Therefore, it is important for a nursing leader to embrace human resources management practices that directly influence the presence of employee engagement in relation to effective communication, employee development, rewards, and recognitions. This writer hopes to implement a reward and recognition strategy for increasing team member motivation and satisfaction, leading to increased RN engagement within a trauma surgical unit. Specifically, a token system in which tokens are rewarded to team members for participation in unit-based activities or professional achievements and are to be traded freely amongst team members as a means of showing appreciation. Each quarter, the team members with the most tokens will be awarded with an extra weekend shift or hard-to-staff holiday off as an incentive. This plan will be presented to team members by this writer and implemented in partnership with the nurse manager and the nurse clinician. This project is intended to display a positive correlation between ensuring higher levels of RN engagement and the occurrence of higher patient satisfaction, increased quality of care, and greater workplace efficiency and effectiveness. Also, this writer hopes to provide intellectual stimulation by promoting innovation and creativity among team members while creating a shared vision, inspiring motivation, and expressing encouragement and appreciation related to desired task completion. As for the token system guidelines, it has been decided that each team member, nurses and care partners, will initially receive 5 tokens. These tokens can then be traded among staff for specific incentives such as trading to cover someone's shift, a friendly thank you for helping during a shift, or for watching a zone during a lunch break, etc. Tokens can be distributed for attending the entire staff meeting and will only be distributed at the end of the meeting to ensure that everyone stays for the entire length of the presentation. Additional tokens can be distributed for implementing new ideas or for unit improvement suggestions during the meeting. A token can be taken by the off-going shift nurse if the oncoming shift nurse is late. This goes for care partners as well. For joining a committee, an individual will gain a token with an additional token distributed for each meeting attended. Professional certifications earn 2 tokens. Each quarter, employees with the highest number of tokens will be awarded an extra weekend shift off. This will be awarded on the 1st of March, June, September, and December. You will lose a token if you miss 2 consecutive staff meetings. It is important for nursing leadership to communicate that this idea is open to any and all suggestions and new ideas. A token champion for the year will be awarded with a special reward in December. Viewing RN engagement as a means of exciting team members to believe in the organization's strategic plan, a nursing leader can promote awareness and understanding of innovative changes, engage team members in the process of change, and encourage commitment to the achievement of goals. As building a shared vision among team members that leads to the implementation of genuine commitment and engagement is a skill that is carefully learned over time, a nurse leader must be invested to continually develop skills necessary for leading and managing change. One key factor that a competent nursing leader must master is understanding financial information and budgeting that allows for improved clinical quality, efficiency, and overall organizational success. The budgetary requirements anticipated for this project include funds for purchasing plastic tokens of appreciation in bulk for distribution, and for a pocket chart for storing each individual's tokens. As the reward for achieving the highest number of tokens is an extra shift off, it is also important for a nursing leader to consider how such would affect scheduling. As nursing leaders must be aware of the importance of increasing RN engagement and retention to optimize patient outcomes, increasing organizational success, and heightening a competitive advantage, it is also key to acknowledge the correlation between increased RN engagement and job performance, leading to improved positive organizational behavior. Furthermore, a nursing leader has the ability to enforce positive workplace relationships, allowing for job satisfaction, employee commitment, and enthusiasm for achievement of organizational success. As this project will be implemented and evaluated quarterly, there is hope that team members will display an increase in attendance of staff meetings, participation in committees, achievement of professional certifications, enhanced teamwork, satisfaction, and retention within a trauma surgical unit. By adding up each team member's tokens, nursing leadership can determine who is engaging and who is not. This project can be altered over time to increase effectiveness, as the goal is to encourage a significant increase in creativity, innovation, change, and positivity within this identified unit over the following year after implementation. By promoting